Body movements. Synovial joints are movable joints and provide most of the body movements. Body movement occurs when the bones, joints, and muscles work together. Flexion and extension. Flexion and extension are movements that take place within the sagittal plane and involve anterior or posterior movements of the body or limbs. For the vertebral column, flexion or anterior flexion is an anterior forward bending of the neck or body, while extension involves a posterior directed motion, such as straightening from a flexed position or a bending backward. Lateral flexion is the bending of the neck or body toward the right or left side. These movements of the vertebral column involve both the joints as well as the associated intervertebral disc. In the limbs, flexion decreases the angle between the bones, bending of the joint, while extension increases the angle and strengthens the joint. You will discover the associated muscles to these movements are flexor and extensor. Abduction and adduction. Abduction and adduction motions occur within the coronal plane and involve medial lateral motions of the limbs, fingers, toes, or thumb. For example, abduction is raising the arm at the shoulder joint, moving it laterally away from the body, while adduction brings the arm down to the side of the body. In the muscular system, you will discover that associated muscles to these movements are abductor and adductor. Circumduction. Circumduction is the movement of a body region in a circular manner, in which one end of the body region being moved stays relatively stationary while the other end describes a circle. It involves the sequential combination of flexion, adduction, extension, and abduction at a joint. Rotation. Rotation can occur within the vertebral column at a pivot joint or at a ball and socket joint. Rotation of the neck or body is the twisting movement produced by the summation of the small rotational movements available between adjacent vertebrae. At a pivot joint, one bone rotates in relation to another bone. Rotation can also occur at the ball and socket joints of the shoulder and hip. Here, the humerus and femur rotate around their long axis, which moves the anterior surface of the arm or thigh either toward or away from the midline of the body. Supination and pronation. Supination and pronation are movements of the forearm. In the anatomical position, the upper limb is held next to the body with the palm facing forward. This is the supinated position of the forearm. In this position, the radius and ulnar are parallel to each other. When the palm of the hand faces backward, the forearm is in the pronated position, and the radius and ulnar form an X shape. Pronation is the movement that allows the palm of the hand to face backward, while in supination, the palm of the hand faces forward. It helps to remember that supination is the motion you use when scooping up soup with a spoon. Dorsiflexion and plantar flexion. Dorsiflexion and plantar flexion are movements at the ankle joint, which is a hinge joint. Lifting the front of the foot so that the top of the foot moves upward toward the anterior leg is dorsiflexion, while lifting the heel of the foot from the ground or pointing the toes downward is plantar flexion. These are the only movements available at the ankle joint. Inversion and eversion. Inversion and eversion are complex movements that involve the multiple plane joints among the tarsal bones of the posterior foot the intertarsal joints, and thus are not motions that take place at the ankle joint. Inversion is the turning of the foot to angle the bottom of the foot toward the midline, while eversion turns the bottom of the foot away from the midline. The foot has a greater range of inversion than eversion motion. These are important motions that help to stabilize the foot when walking or running on an uneven surface and aid in the quick side-to-side changes in direction used during active sports such as basketball, racquetball, or soccer. Protraction and retraction. Protraction and retraction are anterior-posterior movements of the scapula or mandible. Protraction of the scapula occurs when the shoulder is moved forward, as when pushing against something or throwing a ball. Retraction is the opposite motion, with this scapula being pulled posteriorly and medially toward the vertebral column. For the mandible, protraction occurs when the lower jaw is pushed forward to stick out the chin, while retraction pulls the lower jaw backward. Depression and elevation. Depression and elevation are downward and upward movements of the scapula or mandible. The upward movement of the scapula and shoulder is elevation, while a downward movement is depression. These movements are used to shrug your shoulders. At the same time, elevation of the mandible is the upward movement of the lower jaw used to close the mouth or bite on something, and depression is the downward movement that produces opening of the mouth. Common diseases and disorders of the skeletal system. Arthritis. Arthritis often presents as edema, arthralgia, and ankylosis. Common types of arthritis are osteoarthritis, rheumatoid arthritis, fibromyalgia, gout, and lupus. Osteoarthritis is the most common form of arthritis, and according to the Arthritis Society, it affects more than the combination of all other types of arthritis. The breakdown of cartilage and bone occurs over time when joints are exposed to heavy workloads, either through occupation, obesity, and/or prior injury to a joint. Common symptoms are pain, stiffness, and aching that worsens over time. While there is no cure, symptoms can be managed through exercise, medications, and in severe cases, joint replacements. Rheumatoid arthritis. The rheumatoid arthritis is an autoimmune and inflammatory disease. Autoimmune diseases are disorders in which the immune system overreacts and begins to attack itself. In the case of rheumatoid arthritis, inflammation to the joint tissues of the hands, wrists, and knees is painful and debilitating. Treatments may include immunosuppressive drugs and anti-inflammatory drugs. Rheumatoid arthritis can also affect other tissues throughout the body and cause problems in organs such as the lungs, heart, and eyes. Rheumatoid arthritis can affect children, and in this case, it is referred to as juvenile rheumatoid arthritis. Gout. Gout is an inflammatory arthritis caused when the immune system attacks the crystals that form when uric acid builds up in a joint. Gout has periods of exacerbation and remission, and is commonly treated through lifestyle changes and medication. While any joint can be affected, it is common in the lower extremities and most often in the big toe. Myasthenia gravis. Myasthenia gravis is a chronic autoimmune neuromuscular disorder that causes weakness in the skeletal muscle. Fibromyalgia. Fibromyalgia is a challenging disease to diagnose since symptoms manifest differently and are similar to other diseases. Symptoms may include chronic fatigue, gastrointestinal problems, headaches, and increased pain sensitivity. It is often misdiagnosed or dismissed as not real. Osteomyelitis. Osteomyelitis is a bone infection caused when Staphylococcus bacteria travels through the bloodstream from an infection in one part of the body to the bone. Staphylococcus bacteria is found on the skin and it can transfer to the bone through a wound and/or surgical contamination. The risk increases as people age or if their immune system is compromised.